Welcome everyone to another wonderful episode here at Jaws Podiatry. Young gentleman who has flown from the Caribbean, Yaman.
The Virgin Islands?
The Virgin Islands.
Yes,
to see us here in Miami. A young patient presents with a really painful corn, callus, lesion, bottom of the right foot, which has been present for?
At least a year now.
A year, and it's affecting your daily life activities.
Yes, sir.
Without further ado, let's take a look. Okay, so, this is a pretty robust lesion. First metatarsal, second, third. This is the fourth. Fifth is over, all the way over here. So, this is a structural problem. Okay, biomechanical, structural primarily. The symptom is this. We spoke about surgical recommendations versus non-surgical recommendations, and the patient has elected to proceed with
non-surgical
recommendation.
recommendation.
And that's exactly what we're going to do. Today we're going to go ahead and debride this, take a look at what's underneath. I suspect this is a pretty large lesion. Mm-hmm. This is more for pain management, and then of course we recommended also a pair of custom molded accommodative orthotics, kind of like a Tempur-Pedic mattress for the shoes. Little Parmesan action here. First thing that usually comes to mind sometimes when we see a lesion as such, possible foreign body. Right? Did you step on anything, which is what I asked you.
Can't really recall
Right.
stepping on anything out of the way.
So
it was just something farming for years now.
And sometimes what we see with these lesions underneath it, an open sore. Just debriding the lesion accordingly here. When we see these lesions, there's an element of fat pad atrophy. Very little fat.
Mm-hmm.
And we need fat to accommodate, right? Like a pillow for your foot.
Mm-hmm. Mm-hmm.
So when I do this, I already feel the bone. We're essentially enucleating the lesion. Trimming away. Starting to feel a little bit better.
Does it eventually come back to a natural skin? And
this is a great question. The patient is saying, I don't know if you guys noticed, but at the beginning it was more like a hyperpigmented. The pigment was different. It was dark.
Mm-hmm.
So what the patient is asking, correct me if I'm wrong, is, Dr. Wagner, now that you've removed that dark skin, will it come back like that?
Mm-hmm. Right.
There's a possibility.
Mm.
Do you walk barefoot a lot in the islands, man?
No.
Okay.
No.
So,
no, I do not.
Does it come back like that?
Naturally, does it come back like that?
Dark.
Mm.
Does it?
But does it harden up? And
Well, the problem is this: we're only treating the symptom. We're not doing anything with the underlying structure, which is the bone.
mm-hmm.
So is the I think this is $1 million question. Dr. Wagner, is the lesion, the corn, the callus, is it going to come back? And the answer is yes.
Yeah.
It's a big yes.
Mm.
Why? Because we're not doing anything with
The bone.
That's right. Thank you very much. This is the core right here, but it's very fragile. So this is one of those cases that we went ahead, per the patient's request, we numbed the area. This is numb. He had this done before in
The Virgin Islands?
right, by another clinician, and it was very painful.
Yes. Yes, it was.
Right? So he already knew, hey, Dr. Wagner, do me a favor. Can you numb the area before you do this? That's exactly what we did. A little bit more here. And I think it's a win-win. You know, we can do our job a little bit more comfortable, right? Comfortably.
Right. That's true.
No, not, is the patient gonna...
Because as she was doing whatever she was doing, my foot was kind of all over the place.
All over the place, right. And we have to be very careful. We do have something called a knife. Okay, we're all set here. These are... So there's a little core. Of course, the bone right here.
Bone.
Boom, boom, right?
Yeah.
And when you look at the floor, Caesar, I don't know if you can tell, but there's all of that, right? Very simple. Young patient, structural deformity, chronic issue, came from St. Croix in the Caribbean looking for possible solutions here in Miami. We spoke about the conservative versus surgical, right? I said, surgery, no surgery. And he said, no surgery. So then we spoke about the implementation of the custom molded accommodative orthotics. But Dr. Wagner, you have spoken about fat in the past, right? Fat grafting, or the implementation of fat for accommodation purposes. Could we potentially do that here? Sure. But again, that would be possibly another visit, if anything. Right. So, do you have any questions? Maybe some of the questions may benefit the world here. No pressure.
No, I think I asked my question.
Okay, good. So again, great case. This is something very commonly seen. These painful corns, painful calluses, painful lesions. Remember this. This is a symptom of an underlying problem. Please take that home. We will continue to do what we do. We're going to continue to educate the world that these clinical presentations do exist. Possible solutions, conservative, surgical, alternative treatments, and so on and so forth. As always, thank you for watching. You're a good man. Thank you for watching.